Good evening and welcome to Bronx Talk. We have kind of a different show this evening. We have many unique resources in the Bronx. Among them is the Burn Center at New York City Health and Hospitals Jacobi Medical Center. And Jacobi is also home to the largest hyperbaric chamber in the tri-state area. So nice to know we have these resources, but why do we need them? What are they used for? Tonight we talk to the folks who operate the Burn Center as well as the Hyperbaric Chamber, which is a unique, one-of-a-kind health resource in the Bronx. So please join me in welcoming here in our studio the Safety Director of Hyperbaric Medicine at NYC Health and Hospitals Jacobi Medical Center. It is Nikolas Petesic. Nice to see you, sir.
Thank you, sir.
And on Skype, all the way from Jacobi, the chair of the Burn Center is Dr. Hana Lopez Quinones. Dr. Quinones, nice to see you. Thank you for joining us.
Thank you for having me.
Doctor, let's just start with you. So Jacobi is the Bronx's only burn center, the largest hyperbaric chamber in the tri-state area. Describe the burn center facilities and why we're all so excited about the fact that Jacobi has these facilities and how needed they are, et cetera, et cetera.
Yes, so we're one of three burn centers in New York, but we're the only one in the Bronx, as you mentioned before. We are in completely closed off ICU, so we manage our patients completely from admission until they're sent home or they're transferred to a rehab center. And we take care of patients both in the clinic as outpatients and inpatients. And we see about 200 to 300 patients that come in through the ED and get admitted, and probably double that in the outpatient setting. And we manage everything from minor burns to very complex burns that require multiple different types of surgeries for reconstruction.
Are there different times of year where they're more frequent? In other words, do we get more fires, for example, in the winter time because people use heaters, for example? Or is it really, when Dr. Quinones comes into work, it's busy every minute of every day?
It definitely has its ups and downs in terms of how busy we are. Definitely the season influences on the types of burns that we see. So in the winter, we'll for sure see more burns associated to the heater. So contact burns. We've seen really severe house burns because of a candle lighting an apartment on fire. So flame burns can be more prominent in that time of year. Scald burns all throughout, and definitely more in the pediatric population. And then in the summer, we do see people that have accidents related to fireworks and grills. So we see a pretty wide variety of different types of burn injuries and complex wounds.
I saw some very interesting conceptual practices that you use. One is using, animal skins and skin donors. Describe that to me. That's a fascinating thing. Of course, God forbid somebody should get hurt and somebody should get burns, and obviously their skin gets badly affected. You're able to treat those things, and even is it transplants? I mean, how does all that work from even a technical point of view?
Yeah, so taking care of burns is a pretty complex procedure because you have to look at patients as a whole. And people that are very, very sick, they require a very extensive complex care, and we do it in a multidisciplinary manner. So when they're admitted in the hospital, we have a bunch of different people that are part of the team. So we have nutritionists, physical therapists, and our nurses that are pretty dedicated for the wound care in the unit. And definitely hyperbarics plays a role in that for the people that have inhalation injury. But specifically in terms of the wound care, it really depends on the type of burn. So we always try to be conservative in the wound care, but when it comes to the reconstructive process, a burn is a pretty complex field because there are a lot of different alternatives. And we are very fortunate to have a different variety of products that we use in the reconstruction of burns. So animal products are part of it, and we use them as what we call temporary skin coverage to help us reconstruct part of that tissue that is pretty much just gone after they had these severe injuries. And we have novel technologies we even use in the operating room, such as equipment to make a spray on skin when we have really limited amount of donor sites for when we have really large areas that we need to cover. So it's a pretty unique, tailored approach when it comes to what we're going to use on which patient. It really depends on what their initially injuries were, how complex they are, and how many procedures they're going to need in order for us to get these wounds closed and for them to be functional once the entire process in the hospital is done.
I'm just curious about training. You mentioned nurses. Are these nurses who then come to Jacobi and you train them in this very specific area? Or do they get training like maybe through the FDNY or through specialized educational training programs before they get to you? Or is this part of what your responsibilities are to train some of these people?
Yeah, so the nurses that come to our hospital are ICU trained nurses, but when it comes to the specific wound care, because we're the only burn center within the HHC system, it's a more dedicated approach once they're here and they're going to be more full time in the unit. So we try to do education between the nursing staff and also alongside our residents and students that come by. So it's a whole team approach in terms of how things are being taught so that everybody understands how to manage that patient.
You know, it's very easy for those of us in the general public to say, oh, well, you have the burn center there. But, you know, even just in this short discussion, look at the different layers that have to go into putting it together, not only the technology, but then you've got to train personnel in this very specific area. We're now 2 years from that horrible Twin Parks fire that killed 17 from smoke inhalation. Just to put it out there, people remember 120 families lived in the 19-story building. 17 people died from that smoke inhalation. It was the city's deadliest fire in more than 3 decades. I guess this is where we start to bring Mr. Petesic into it. But did you treat people, let's say, before they went into the hyperbaric area? Or was it really because it was just smoke inhalation? You send them all to Mr. Petesic and his people.
So the way that we approach this, and we created this protocol together with the emergency room and the hyperbarics team, is to how we can streamline assessing these patients because they definitely need to be managed pretty quickly. So we get a call, we evaluate the patients in the emergency room, decide how stable they are, and if they would be able to tolerate being in the hyperbarics chamber, as he'll go into more detail, because it's not just putting them in the chamber, right? They need to be able to be in the space and have good vital signs and make sure that they're not going to get complicated once they're locked into that chamber. So we make our assessment and we talk to the teams, and depending on what the patient's needs are, then we'll decide where they go first.
Mr. Petesic, that brings you into the conversation. One of the
Yes.
questions I asked you before we sat down here was the relationship between the hyperbaric area and also the burn center. Clearly, that would be as good an example of where you really had to work together as any. Talk about how you work together and why having both of these facilities at Jacobi Medical Center is important.
Well, I think we work very closely with the burn service and Dr. Lopez Quinones and her team of doctors and nurses and her interdisciplinary team. We often see patients in the emergency department when they initially present, and then if the patients are candidate for hyperbaric therapy, they may come to us in the chamber, and then often we transfer patients. I was up in the burn unit last week transferring patients up from smoke inhalation to that specialized care. And it's really important to have this cohesive effort among the different disciplines. And I think the residents of the Bronx and this region are lucky to have that resource here.
I started out by talking about the relationship between you, as well as the many layers that go into it. It's not like you just have the facility and you kind of do it. This really requires coordination, of course, to the betterment of the people. Well, let's talk about the hyperbaric chamber. People say, "Oh, really? What is that?" Describe what it is. Describe this facility. We have some pictures and video and things that we're going to show. It's quite. It looked like a submarine to me, but tell us what it's all about.
Absolutely. So our hyperbaric chamber has been here at Jacobi for about 30 years now. The program initially had its roots in City Island in the 80s, and then was a need for this program was developed, and the chamber was brought in the early 1990s to Jacobi. The chamber is about 24 feet long, 7 feet in diameter, can fit 6 patients seated on one side of the chamber and 3 on another. In addition, the staff goes inside. So you have doctors, nurses, technicians going inside this chamber to provide care under pressure and provide hands-on critical care with ventilators and IV pumps if that's required, and really give a hands-on level that most other hyperbaric chambers cannot provide. And we're on call 24/7, 365 days a year for residents of this area and the region.
Explain to me about CO2 poisoning. I mean, this is a big thing. So you put people in there, and because of again, my science knowledge is not tremendous, but because of the pressure, it helps them learn to breathe. In layman's term, for me and for our friends in the Bronx, describe exactly why we need a chamber like this.
Right. So carbon monoxide poisoning, or CO poisoning, is one of the leading causes of death by poisoning and is responsible for many, many, many emergency room visits. Essentially, when you breathe carbon monoxide, and one of the byproducts of fire can be carbon monoxide. That's not the only way you can get carbon monoxide poisoning. For instance, somebody running a car in a closed space, or somebody smoking a hookah pipe with charcoal, or somebody loses power who puts a charcoal grill inside their house and now has
the
fumes.
House fills up.
Exactly.
Oh.
It's essentially, carbon monoxide is a byproduct of combustion. So we see it very commonly in house fires. Unfortunately, the Twin Parks fire was an example of carbon monoxide poisoning and smoke inhalation with bad inhalation injuries. But carbon monoxide binds to that hemoglobin molecule, that red blood cell molecule that brings oxygen throughout your body. And it has a really great affinity for that molecule. And the hyperbaric chamber can help reverse that. So when we bring patients into the hyperbaric chamber, they breathe oxygen under pressure. So we almost simulate the pressure of deep sea diving.
I went through all the notes, and there was talk about deep sea diving, and you mentioned that it was originally located on City Island before it was moved not too far away at Jacobi Medical Center. How often do those kinds of things come up? And if they come up, let's say somewhere else, people are transported to you. I mean, describe that whole thing. I thought it was fascinating. Wait a minute, deep sea diving here in our urban Bronx?
Yeah.
I'm not getting it.
So the first hyperbaric chambers in North America were around in the late 1800s. And a lot of people were realizing when they were building caissons to build bridges, for example, the Brooklyn Bridge, hundreds of workers actually that would go down into the caissons to build the bridge were coming up with something called the bends. They would walk bent over. And that was the early recognition of decompression illness, or the bends from deep sea diving and from the pressure disease. So what happens is that they realize if we pressurize people and put them inside a hyperbaric chamber, we can reverse those effects. So that essentially hyperbaric chamber here in America got its start right here in New York City. And then as far as diving, and diving has gotten much, much safer. People recreational dive, we have public safety divers, but the hyperbaric chamber is available if patients do have a diving injury. So we receive approximately 5 to 10 people a year who have diving injuries. We are available for the region. Some of them come from us from upstate New York or Pennsylvania or Massachusetts, and we're available to treat them. We're a U.S. Navy certified facilities to treat naval personnel with diving injuries also.
You mentioned naval personnel is one of the questions I have. You have a relationship with the United States Navy, and it's been a fruitful relationship, 2 ways. Describe what that relationship is like, if you would.
That's correct. So the Navy does diving operations all throughout the world, but they also do diving operations in this area. There's Naval Station Earl down in Jersey that does screening for weapons for underneath the Hudson River for the United Nations, for presidential visits. And if one of those divers were to be injured, they'd have to be taken somewhere for recompression in a chamber, and we are the closest chamber. Jacobi also has a heliport, so they could be flown directly to us for treatment in the chamber. And our chamber is capable of diving at very deep depths. The chamber is rated to go to 165 feet of seawater. So imagine, it's almost like simulating the pressure of being 165 feet underwater, and that can help reverse the effects of decompression illness.
Fascinating. We'll bring Dr. Lopez Quinones back in the conversation in just a moment, but I asked her about training of personnel. If you're the only facility, how do you train people, or do you literally train them at Jacobi Medical Center, or are they trained elsewhere and then come to you? How does that? Do they live in submarines to figure it out?
So we have a wide variety of members of our team. My predecessor was a U.S. Navy diver, actually, before he became a nurse, and a U.S. Navy medic. So he brought his background, and we have people that have done some commercial diving. But then we also have people like myself who were trained in-house, who essentially came with a nursing background, who were interested in the field of diving and hyperbaric medicine, who did their training at Jacobi. And
absolutely fascinating. Dr. Lopez Quinones, let me just ask you about kind of the balance between facility and talent and expertise of practitioners. Is this the kind of thing where you say, gee, we could use more facility, or is we've got what we need now, we just need to keep training personnel and making sure that aspect of our service delivery stays consistent?
I think in terms of burn care specifically, there's definitely always a need for more. So more resources and more personnel that's interested. This is a very particular field that requires a lot of dedication, and it's very complex, and it can be a little bit overbearing when you're seeing how extensive some of these injuries can be. So you really want to do this, right? To take care of this special population. And I would say, some people may consider being a specific burn surgeon kind of a dying art. All throughout the country, we're seeing there is a shortage of burn surgeons. So we definitely encourage more people to train in this, because you have a very different approach in terms of wound reconstruction, not just for burns, for wounds in general, when you have this specific kind of training. So there's always a need for expansion, both in terms of the resource that we have within the hospital, within the field, but certainly for personnel and even doctors and nurses that are trained in treating these very particular types of patients.
Mr. Petesic, you told me before the show, we talked a little bit about the $10 million grant you had gotten through, I guess it was the city council,
yes.
Which certainly helped the facility grow. And for you, the technology is probably vital, and you need to keep growing it, right?
Absolutely. Our equipment at Jacobi, we have $10 million in funding that our city council is able to give us, and we are so grateful for that. Our community stakeholders, in addition to our hospital leadership, really made getting a new hyperbaric chamber and getting a new hyperbaric facility a priority for them. And if you think about it, if you look at it, it looks kind of like a submarine.
That's what I said, yeah.
And it's 30 years old, right? So it's like an old car. That's a vintage car. And, now with this funding, we know that the Bronx residents and the residents of this region really are going to have a new chamber facility coming to them within the next few years, which is really important.
That's nice to know.
And hopefully have a surrounding clinic with infrastructure around it. So with this new chamber and with this funding, we can treat residents of the Bronx and New York City for years and decades to come, and also be available for the region for those emergencies like scuba divers and carbon monoxide emergencies.
One thing I didn't ask you about, which is in my notes to ask you about, is the effects of radiation.
Yes.
And again, I'm not a medical doctor and don't have a great background in it. How were we treating it in the past, and how does the hyperbaric chamber at Jacobi help deal with it? And I guess the other part of it is, does it come up a lot? I mean, it would surprise me if it does. We all live and work in the Bronx. I wasn't aware that we have radiation issues.
So radiation mostly is used in a medical terminology, to kill cancer, right? So people have
Oh, yes, of
prostate
course.
cancer
How naive
or
of me.
or a
Yes.
GYN cancer or a head and neck cancer. Radiation is excellent at irradiating cancer cells and potentially cure some of their cancer, but it also affects some of the soft tissue in the surrounding areas. And that effect of radiation can have downstream effects, and there's sometimes adverse effects that patients have. So bringing them into the hyperbaric oxygen chamber, they come in for a series of treatments, maybe 20, 30, potentially even 40 treatments, where they come Monday through Friday for 2 hours a day and sit in the chamber and breathe oxygen under
Wow.
pressure. And that oxygen can force new blood vessels into the irradiated tissues.
2 hours a day. In fact, I think I saw the number was 110 minutes.
Correct.
And there's the TV in there and all those kinds of
No
things.
TV, not
No
yet.
TV.
Hopefully in the
Put
new
BronxNet
chamber.
on there. That would be great.
BronxNet will be the first show we show in the
There
new
you
chamber
go.
with the TV.
The other question I want to ask you, and we will ask Dr. Lopez Quinones the same question, and that is about insurance. A lot of times with new treatments, with specialized treatments, people say, hey, they're not covering it. All of a sudden, I got a, who knows how many thousands of dollars bills. Is that one of the issues here, or is it part of any medical treatment that it gets covered?
So I'm fortunate to be working at New York City Health and Hospitals, which treats patients regardless of the ability to pay, regardless of insurance status. But there are some regulations as far as what we can and cannot treat. And the Centers for Medicare and Medicaid have very strict guidelines about the things we can treat in our chamber. So we will ask insurance companies for prior approval prior to treating them. If it's something that's an emergency, like carbon monoxide poisoning or smoke inhalation or scuba diving injury, we're going to treat them regardless. But before they come to us for a series of treatments, we'll check with their insurance. Now, insurers may not cover some treatments that they deem are experimental. And that's where we have to go. Our physicians will go back and forth with the insurance company and try and do the best thing for the patient.
I'm smiling because I'm holding back from my editorial comment about that, but we'll save that for another day and another show. Dr. Lopez Quinones, what about burn treatments and the coverage for burn treatments? If you're, God forbid, in a fire or something, do you then get stuck with a big insurance bill if you've been treated over there at Jacobi Medical Center?
Now, as Mr. Petesic said, we are a city hospital, so we will treat anybody that comes through those doors because burns are an emergency. And if they need treatment, they're going to get treated regardless of their insurance status. We definitely, as part of the team that works with our patients when they're in the hospital, we have really good social workers and case managers. So if they need emergency Medicaid coverage, they'll help the patients to figure out that paperwork so that they don't get slapped with a huge bill afterwards. When it comes to the more elective stuff, certainly it's pretty much the same process as the hyperbarics. We sometimes need to send for pre-authorization of certain specific materials that we may use or for elective surgeries. But if it's an emergency and they need the treatment, they're going to receive it regardless of what their coverage is.
I like Dr. Lopez Quinones. I like to ask this question to people in all different fields. So I'm going to ask you the same thing. Do you love your work? Is it frustrating? You have people who come in who, obviously are burned very badly, and you're going to do obviously the best you can. Is it frustrating? I mean, talk to me about you and doing this work and being part of the burn center. What's rewarding? What's difficult? How do you view it for yourself?
I mean, I would say, like any job, it has difficult days and difficult moments. And, some patients that it's really, really hard to have success stories, but we try our best every day and we do it because we love what we do and because we have a passion for it. And certainly I have that passion for these patients and to seeing those good outcomes and having them walk out the door and come back a few months later. Some of these patients, after they come back from rehab, just walking in, showing us the wounds that have healed really well. So that's what makes it worth it. But it's not without its challenges, but that's a normal part of life.
Sure, and certainly anybody in the medical profession has to deal with that sort of thing. I didn't want to be too negative about it and you just described it beautifully. It must be incredibly gratifying when somebody comes back later and says, "Wow, look at me! You guys did it." That must that must be celebration day for you.
It definitely is. We like to see those success stories, and even on the days where it kind of seems impossible, we still try.
Yes, it's a beautiful thing, and that's the dedication of all our medical personnel. Obviously, excuse me, not Doctor, Mr. Petesic. We want to ask you the same kind of question. People must be amazed, I'm guessing, when they come in and they say, "Wait a minute, I'm going in there, and this is going to help like a difficult problem." I saw a video of you treating somebody with diabetes who had pains in their legs. And I was like, wait a minute, that you're doing it there? Talk to me a little bit from your perspective and what you do and how that works.
Sure. So I try and describe it to some patients before on the phone, or whether I see them in the emergency department or upstairs, but they have to see it. And once they see it, they're like, whoa, I can't believe we're going in there. But then they get used to it. It's almost like flying on an airplane or going on a subway car, right? I say, if you can ride in the subway,
traveling in a submarine,
yeah, you can come in our chamber. And somebody's in there with them. So I may be in there with them. One of our staff may be in there with them. One of our team members is in there with them. So it really is a personalized experience that they receive. And they're with other patients too, potentially.
I guess this conversation serves to announce to the general public this resource is here for you.
Yes.
Jacobi Medical Center is ready to have people come in, and it's a welcoming place. Better to know about it, which is of course what BronxNet does. And so Nick Petesic at Jacobi Medical Center, thank you for expanding our minds, expanding our opportunities. We really appreciate your time.
Thank you for having us.
And over there at Jacobi Medical Center, Dr. Hana Lopez Quinones, thank you so much. I know you got patients sitting there waiting for you, and don't blame us for taking you away for a half hour, but we really do appreciate your time this evening, and continued good success. And let's hope we have many, many more successes than difficulties.
Great. Thank you so much for having me. Appreciate the opportunity.
Great. Folks, that will do it for our program this evening. We thank our producer. It's Rebecca Hemick. Our director is Will Guzman. We have a cast of thousands around us who work with us here in the studio. And of course, to you too, the people of the Bronx. You learned about a good opportunity. Make use of it, you know. Next week, we will take a look at the leaders. We'll talk with the leaders of some of the borough's most important after-school program providers to understand the resources that are available that can keep our kids productive and off the streets after school hours, which is, of course, an ongoing vital concern that affects all of us. So, as we always say, if the curtain don't fall and the creek don't rise, we will be here next week to talk about after-school programs. See you then. Good night.